I'm Edward Yang, the Chief of Orthopedics at Mount Sinai, Queens. I came here to start a general orthopedic practice. Before I was taking care of a busy level 1 trauma center, and here I wanted to take care of patients on a more personal basis. A hip replacement is another operation which we typically do at this hospital. This is just a model of a hip replacement. There's two parts of this operation. One is replacing the socket, which we will typically press fit a metal ring and a plastic liner. And on the femoral side, we will remove the arthritic ball of the femur and we'll press fit a stem, and either a metal or ceramic head will be placed to articulate with the plastic. And typically this operation takes a couple hours, and the recovery in the hospital is 2 to 3 days, and the patients usually feel better almost 2 to 3 days after the operation. They feel like their hip is totally different. Their pain is from the operation. The arthritic pain that they used to feel is gone, and they can feel that there's hope on the horizon. The therapy for this is usually walking, and you just need some supervision to walk, and when you go home, the rehabilitation is getting out of bed and walking. I'll tell you a story about a patient I just took care of. I saw yesterday in my Forest Hills office. He's a school bus driver, had bilateral hip arthritis, could barely walk. He had to sit with his legs crossed. Somehow he was still driving a school bus, and when he came in to decide to do the operation, he was literally begging me to do the operation, but he had waited many years. We did his operation 2 months ago. He's walking. He's much taller now because he's not all bent over. His family and his wife says he's a new man. He wants to go back and drive the school bus and have his other hip done in January. So that to me makes me feel very good, and it's very satisfying.